Chronic obstructive pulmonary disease, COPD, is one of the most commonly tested respiratory disorders on the Nclex. Questions often assess your understanding of oxygen therapy, breathing techniques, medications, complications, and nursing priorities. These practice questions are designed in Nclex style to strengthen your clinical judgment and help you answer COPD questions with confidence. Question 1. A nurse is caring for a client with chronic obstructive pulmonary disease, COPD. Who is experiencing shortness of breath? Which nursing intervention should the nurse perform first? A. Encourage the client to drink more fluids. B. Place the client in a high Fowler's position. C. Administer a prescribed stool softener. D. Limit the client's activity for the rest of the day. Correct answer: B. Place the client in a high Fowler's position. Rationale. Positioning the client upright immediately improves lung expansion and reduces the work of breathing. This is the priority intervention because it helps relieve respiratory distress before other treatments are provided. Strategy. When a client has difficulty breathing, always think airway and breathing, ABCs, first. Choose the intervention that improves oxygenation the fastest. Question 2. A client with COPD is being taught pursed lip breathing. What is the primary purpose of this technique? A. Increase respiratory rate. B. Prevent airway collapse during exhalation. C. Eliminate the need for oxygen therapy. D. Increase mucus production. Correct answer: B. Prevent airway collapse during exhalation. Rationale. Pursed lip breathing helps keep the airways open longer during exhalation. This reduces air trapping and improves gas exchange. Strategy. Look for interventions that improve ventilation in COPD. Techniques that prolong exhalation are often correct. Question 3. Which assessment finding is most expected in a client with chronic COPD? A. Slow, shallow respirations. B. Barrel-shaped chest. C. Bradycardia. D. Moist skin. Correct answer: B. Barrel-shaped chest. Rationale. Hyperinflation of the lungs over time causes the chest to become barrel-shaped. This is a common physical finding in COPD. Strategy. Remember the classic signs of COPD: barrel chest, prolonged expiration, and decreased breath sounds. Question 4. A nurse is administering oxygen to a client with COPD. Which oxygen flow rate is generally appropriate unless otherwise prescribed? A. 1 to 2 liters per minute by a nasal cannula. B. 8 liters per minute by a simple mask. C. 10 liters per minute by a non-rebreather mask. D. 15 liters per minute by a face tent. Correct answer: A. 1 to 2 liters per minute by a nasal cannula. Rationale. Clients with COPD often require low-flow oxygen to maintain adequate oxygenation. Excessive oxygen may reduce the respiratory drive in some clients. Strategy. When oxygen therapy appears in COPD questions, think low and slow unless severe hypoxia requires otherwise. Question 5. Which instruction should the nurse include when teaching energy conservation to a client with COPD? A. Perform all activities as quickly as possible. B. Rest between activities. C. Avoid sitting during daily tasks. D. Skip meals to conserve energy. Correct answer: B. Rest between activities. Rationale. Taking frequent rest breaks decreases oxygen demand and reduces fatigue. This helps clients complete daily activities more comfortably. Strategy. Choose interventions that reduce oxygen consumption and prevent unnecessary exertion. Question 6. Which medication is classified as a bronchodilator commonly used to treat COPD? A. Salbutamol, albuterol. B. Furosemide. C. Warfarin. D. Omeprazole. Correct answer: A. Salbutamol, albuterol. Rationale. Salbutamol relaxes bronchial smooth muscles, making breathing easier. It is commonly prescribed for relief of bronchospasm. Strategy. Identify medications by their purpose. Bronchodilators improve airflow in obstructed airways. Question 7. Which finding indicates that treatment for a client with COPD is effective? A. Increased work of breathing. B. Oxygen saturation improves to the prescribed target range. C. Increased anxiety and restlessness. D. Respiratory rate continues to rise. Correct answer, B. Oxygen saturation improves to the prescribed target range. Rationale. Improved oxygen saturation and easier breathing indicate effective therapy. These findings suggest better oxygen exchange. Strategy. Select answers that show improvement in respiratory status rather than worsening symptoms. Question 8. A nurse is caring for a client with COPD who has thick secretions. Which intervention is most appropriate? A. Encourage adequate fluid intake if not contraindicated. B. Restrict fluids. C. Limit coughing. D. Keep the client flat in bed. Correct answer, A. Encourage adequate fluid intake if not contraindicated. Rationale. Adequate hydration helps thin respiratory secretions, making them easier to cough up. This promotes airway clearance. Strategy. Think about what helps remove mucus. Thin secretions are easier to expectorate than thick ones. Question 9. Which meal selection is best for a client with COPD? A. 3 large meals daily. B. Small, frequent, high-calorie meals. C. High-fat snacks only. D. Meals immediately before bedtime. Correct answer, B. Small, frequent, high-calorie meals. Rationale. Small meals reduce the effort required for eating and breathing at the same time. High-calorie foods help meet energy needs. Strategy. Avoid answers that increase fatigue during meals. Small, frequent meals are commonly recommended. Question 10. A client with COPD suddenly becomes restless and confused. What should the nurse do first? A. Assess the client's oxygenation status. B. Offer food and fluids. C. Encourage the client to sleep. D. Document the findings and reassess in 1 hour. Correct answer, A. Assess the client's oxygenation status. Rationale. Restlessness and confusion may be early signs of hypoxia. Immediate assessment allows prompt intervention before the condition worsens. Strategy. When a client develops an acute change in mental status, think hypoxia first. Follow the ABCs and assess before taking other actions. Question 11. A nurse is assessing a client with COPD. Which breath sound is most commonly heard? A. Crackles only. B. Wheezes. C. Pleural friction rub. D. Stridor. Correct answer, B. Wheezes. Rationale. Wheezing occurs because narrowed airways obstruct airflow. It is a common finding in clients with COPD. Strategy. Think about airway narrowing. Wheezes are usually associated with bronchoconstriction and airflow obstruction. Question 12. Which arterial blood gas, ABG, finding is most consistent with chronic COPD? A. Low PaCO2. B. High PaCO2. C. High pH only. D. High bicarbonate with low PaCO2. Correct answer, B. High PaCO2. Rationale. COPD commonly causes carbon dioxide retention due to impaired ventilation. Chronic clients may also have compensated respiratory acidosis. Strategy. Remember that COPD often leads to CO2 retention. Watch for elevated PaCO2 values. Question 13. Which action by the nurse helps reduce dyspnea during meals? A. Encourage large meals. B. Allow the client to rest before eating. C. Serve food while the client is lying flat. D. Limit fluid intake during the day. Correct answer, B. Allow the client to rest before eating. Rationale. Resting before meals conserves energy and reduces shortness of breath while eating. Clients are better able to tolerate meals. Strategy. Choose interventions that reduce oxygen demand before activities. Question 14. A client with COPD reports increased sputum that is thick and green. What should the nurse suspect? A. Improvement of the disease. B. Respiratory infection. C. Dehydration only. D. Heart failure. Correct answer, B. Respiratory infection. Rationale. Green sputum often indicates a bacterial respiratory infection. Clients with COPD are at increased risk for infections. Strategy. Changes in sputum color and amount often suggest infection. Question 15. Which position helps a client with COPD breathe more easily? A. Supine position. B. Trendelenburg position. C. Tripod position. D. Prone position. Correct answer, C. Tripod position. Rationale. Leaning forward with the arms supported improves chest expansion and decreases the work of breathing. Strategy. Remember that clients naturally assume positions that maximize lung expansion. Question 16. Which finding should the nurse report immediately? A. Mild fatigue after walking. B. Respiratory rate of 36 breaths/min with severe distress. C. Productive morning cough. D. Occasional wheezing. Correct answer, B. Respiratory rate of 36 breaths/min with severe distress. Rationale. Severe respiratory distress indicates worsening ventilation and requires immediate intervention. Strategy. Identify life-threatening findings first. Severe breathing difficulty is always a priority. Question 17. Which vaccine is especially recommended for clients with COPD? A. Rabies vaccine. B. Influenza vaccine. C. Yellow fever vaccine. D. HPV vaccine. Correct answer, B. Influenza vaccine. Rationale. Influenza can trigger severe COPD exacerbations. Annual vaccination helps reduce this risk. Strategy. Preventing respiratory infections is a major goal in COPD management. Question 18. A nurse teaches a client to cough effectively. Which instruction is appropriate? A. Take several shallow breaths. B. Take a deep breath and cough forcefully. C. Hold the breath for 30 seconds before coughing. D. Avoid coughing to reduce fatigue. Correct answer, B. Take a deep breath and cough forcefully. Rationale. Deep breathing followed by a controlled cough helps remove mucus from the airways. Strategy. Choose techniques that promote airway clearance safely. Question 19. Which laboratory result should the nurse expect in a client with chronic hypoxemia from COPD? A. Decreased hemoglobin. B. Increased hematocrit. C. Low platelet count. D. Low white blood cell count. Correct answer, B. Increased hematocrit. Rationale. Long-term hypoxia stimulates the production of more red blood cells to improve oxygen transport. Strategy. Chronic hypoxia often leads to polycythemia. Think more red blood cells. Question 20. A client with COPD asks why smoking cessation is important. Which response is best? A. It completely cures COPD. B. It slows disease progression and improves lung function. C. It removes all lung damage. D. It eliminates the need for medications. Correct answer, B. It slows disease progression and improves lung function. Rationale. Stopping smoking slows further lung damage and decreases exacerbations. It is the most important lifestyle change for COPD. Strategy. Choose realistic benefits rather than absolute statements like cures or eliminates. Question 21. Which finding suggests a COPD exacerbation? A. Decreased cough. B. Increased shortness of breath and sputum production. C. Lower respiratory rate. D. Improved exercise tolerance. Correct answer, B. Increased shortness of breath and sputum production. Rationale. Worsening dyspnea and increased sputum are common signs of an acute exacerbation. Strategy. Recognize changes from the client's baseline respiratory status. Question 22. Which medication should the nurse expect to administer during an acute COPD exacerbation? A. Short-acting bronchodilator. B. Insulin. C. Iron supplement. D. Antacid. Correct answer, A. Short-acting bronchodilator. Rationale. Short-acting bronchodilators quickly relieve bronchospasm and improve airflow during exacerbations. Strategy. For acute symptoms, choose medications that act rapidly. Question 23. Which nursing diagnosis has the highest priority for a client with severe COPD? A. Disturbed body image. B. Impaired gas exchange. C. Social isolation. D. Knowledge deficit. Correct answer, B. Impaired gas exchange. Rationale. Adequate oxygenation is essential for survival. Gas exchange problems take priority over psychosocial concerns. Strategy. Apply the ABCs when prioritizing nursing diagnoses. Question 24. Which breathing pattern is commonly seen in clients with COPD? A. Rapid, prolonged expiration. B. Cheyne-Stokes respirations. C. Apnea only. D. Kussmaul respirations. Correct answer, A. Rapid, prolonged expiration. Rationale. Air trapping causes clients to take longer to exhale. This is a hallmark of COPD. Strategy. Remember that exhalation is more difficult than inhalation in COPD. Question 25. A nurse encourages pulmonary rehabilitation because it helps. A. Cure COPD permanently. B. Improve exercise tolerance and quality of life. C. Replace medications. D. Prevent all exacerbations. Correct answer, B. Improve exercise tolerance and quality of life. Rationale. Pulmonary rehabilitation combines exercise, education, and breathing techniques to improve daily functioning. Strategy. Choose answers that focus on managing, not curing, COPD. Question 26. Which oxygen saturation level generally indicates effective oxygen therapy for many stable COPD clients? A. 100%. B. 98 to 100%. C. 88 to 92%. D. 70 to 75%. Correct answer, C. 88 to 92%. Rationale. Many clients with COPD are managed with a target oxygen saturation of 88 to 92% to maintain adequate oxygenation while avoiding excessive oxygen administration. Strategy. No common target oxygen saturation ranges tested on the Nclex. Question 27. A client with COPD becomes anxious during episodes of dyspnea. What should the nurse do first? A. Encourage slow pursed lip breathing. B. Leave the room. C. Restrict fluids. D. Ask the client to lie flat. Correct answer, A. Encourage slow pursed lip breathing. Rationale. Pursed lip breathing slows exhalation, improves ventilation, and helps reduce anxiety associated with breathlessness. Strategy. Select interventions that immediately improve breathing before addressing other concerns. Question 28. Which environmental factor should a client with COPD avoid? A. Clean indoor air. B. Cigarette smoke and air pollution. C. Moderate humidity. D. Adequate ventilation. Correct answer, B. Cigarette smoke and air pollution. Rationale. Smoke and pollutants irritate the airways and can trigger COPD exacerbations. Strategy. Avoid environmental triggers that worsen respiratory symptoms. Question 29. Which client statement indicates that teaching about COPD medications has been effective? A. I'll stop my inhaler when I feel better. B. I'll use my medications exactly as prescribed. C. I'll double my dose if I become short of breath. D. I'll only take my medication at bedtime. Correct answer, B. I'll use my medications exactly as prescribed. Rationale. Consistent medication use helps control symptoms and reduce exacerbations. Medications should not be stopped or adjusted without provider guidance. Strategy. Look for statements that reflect safe medication adherence. Question 30. A client with COPD is discharged home. Which instruction is most important? A. Avoid all physical activity. B. Stop taking medications when symptoms improve. C. Seek medical care promptly if breathing suddenly worsens. D. Drink less water every day. Correct answer, C. Seek medical care promptly if breathing suddenly worsens. Rationale. Sudden worsening of breathing may indicate a serious exacerbation that requires immediate evaluation and treatment. Early intervention can prevent respiratory failure. Strategy. Discharge teaching should emphasize recognizing danger signs and knowing when to seek immediate medical attention. Question 31. A client with COPD is prescribed an inhaled corticosteroid. Which instruction should the nurse provide? A. Swallow the medication after inhaling. B. Rinse the mouth after each use. C. Use it only during an acute attack. D. Stop taking it when breathing improves. Correct answer, B. Rinse the mouth after each use. Rationale. Rinsing the mouth helps prevent oral thrush caused by inhaled corticosteroids. It also removes any medication remaining in the mouth. Strategy. Remember the special teaching for inhaled steroids, always rinse the mouth after use. Question 32. Which finding indicates that a client with COPD may be developing respiratory failure? A. Alert and oriented. B. Increasing drowsiness and confusion. C. Improved appetite. D. Respiratory rate of 18 breaths/min. Correct answer, B. Increasing drowsiness and confusion. Rationale. Changes in mental status can indicate worsening hypoxia or hypercapnia. Immediate assessment and intervention are required. Strategy. Sudden neurological changes in a respiratory patient should always raise concern for inadequate oxygenation. Question 33. Which nursing intervention helps prevent atelectasis in a client with COPD? A. Encourage deep breathing exercises. B. Restrict coughing. C. Keep the client on bed rest. D. Limit fluid intake. Correct answer, A. Encourage deep breathing exercises. Rationale. Deep breathing promotes lung expansion and helps prevent alveolar collapse. It also improves ventilation. Strategy. Choose interventions that improve lung expansion and airway clearance. Question 34. A client with COPD asks why exercise is recommended. Which response is best? A. It completely restores lung function. B. It improves endurance and reduces shortness of breath during activity. C. It replaces oxygen therapy. D. It prevents the need for medications. Correct answer, B. It improves endurance and reduces shortness of breath during activity. Rationale. Regular exercise strengthens muscles and improves activity tolerance. It helps clients perform daily activities with less fatigue. Strategy. Exercise improves function but does not cure COPD. Question 35. Which finding requires immediate nursing intervention? A. Mild productive cough. B. Bluish discoloration of the lips. C. Occasional wheezing. D. Fatigue after walking. Correct answer, B. Bluish discoloration of the lips. Rationale. Cyanosis indicates significant hypoxemia and requires prompt intervention. It is a sign of inadequate oxygenation. Strategy. Visible signs of hypoxia always take priority. Question 36. A nurse is evaluating breathing techniques. Which finding indicates that pursed lip breathing is effective? A. Increased respiratory distress. B. Slower, controlled breathing with reduced dyspnea. C. Increased coughing only. D. Rapid shallow respirations. Correct answer, B. Slower, controlled breathing with reduced dyspnea. Rationale. Pursed lip breathing slows exhalation and decreases air trapping. Clients often report easier breathing. Strategy. Choose outcomes that demonstrate improved ventilation. Question 37. Which statement by a client with COPD indicates a need for further teaching? A. I'll avoid smoking. B. I'll receive my yearly flu vaccine. C. I'll stop taking my medications once I feel better. D. I'll practice pursed lip breathing. Correct answer, C. I'll stop taking my medications once I feel better. Rationale. COPD medications should be taken as prescribed even when symptoms improve. Stopping treatment increases the risk of exacerbations. Strategy. Look for unsafe statements about medication adherence. Question 38. Which diet is most appropriate for a client with COPD? A. Small, frequent, nutrient-dense meals. B. One large meal daily. C. High-sugar snacks only. D. Meals with no protein. Correct answer, A. Small, frequent, nutrient-dense meals. Rationale. Small meals reduce fatigue while eating and provide adequate nutrition. Nutrient-dense foods meet increased energy needs. Strategy. Select meals that conserve energy and support nutrition. Question 39. Which assessment finding is expected in advanced COPD? A. Clubbing of the fingers. B. Dry, pink lips only. C. Decreased chest diameter. D. Slow pulse with no respiratory symptoms. Correct answer, A. Clubbing of the fingers. Rationale. Long-term oxygen deficiency may result in finger clubbing. It is often seen in chronic respiratory diseases. Strategy. Think of chronic hypoxia when you see clubbing. Question 40. A nurse should encourage which fluid intake if not contraindicated? A. 2 to 3 liters per day. B. Less than 500 milliliters daily. C. No fluids after noon. D. Fluids only with meals. Correct answer, A. 2 to 3 liters per day. Rationale. Adequate hydration helps thin respiratory secretions and promotes effective coughing. Always consider contraindications such as heart failure. Strategy. Hydration is important for airway clearance. Question 41. Which symptom is commonly seen during a COPD exacerbation? A. Decreased sputum production. B. Chest tightness and worsening dyspnea. C. Improved exercise tolerance. D. Decreased respiratory effort. Correct answer, B. Chest tightness and worsening dyspnea. Rationale. Acute exacerbations usually cause worsening shortness of breath and chest tightness. These symptoms require prompt treatment. Strategy. Identify symptoms that represent deterioration rather than improvement. Question 42. Which nursing action has the highest priority during an acute COPD exacerbation? A. Assist the client into a high Fowler's position. B. Provide health teaching. C. Encourage family visitation. D. Offer a large meal. Correct answer, A. Assist the client into a high Fowler's position. Rationale. An upright position promotes lung expansion and improves ventilation immediately. This helps relieve respiratory distress. Strategy. Prioritize interventions that improve breathing first. Question 43. A client with COPD asks why coughing is encouraged. What is the best response? A. It strengthens your lungs. B. It helps remove mucus from your airways. C. It lowers your blood pressure. D. It cures your lung disease. Correct answer, B. It helps remove mucus from your airways. Rationale. Effective coughing clears secretions that can obstruct airflow. This improves breathing and reduces infection risk. Strategy. Focus on airway clearance when answering coughing questions. Question 44. Which complication is a client with COPD at increased risk for? A. Respiratory infections. B. Appendicitis. C. Migraine headaches. D. Peptic ulcer disease. Correct answer, A. Respiratory infections. Rationale. Damaged airways and impaired mucus clearance increase the risk of lung infections. Strategy. COPD commonly leads to respiratory complications. Question 45. Which assessment finding suggests improved oxygenation? A. Restlessness. B. Cyanosis. C. Oxygen saturation within the prescribed target range. D. Confusion. Correct answer, C. Oxygen saturation within the prescribed target range. Rationale. Maintaining oxygen saturation within the prescribed range indicates adequate oxygen delivery to tissues. Strategy. Choose objective findings that show improvement. Question 46. A client with COPD is using home oxygen therapy. Which safety instruction is most important? A. Smoke while using oxygen. B. Keep oxygen away from open flames. C. Store oxygen near a heater. D. Apply petroleum jelly inside the nostrils. Correct answer, B. Keep oxygen away from open flames. Rationale. Oxygen supports combustion and greatly increases the risk of fire. Safe storage and handling are essential. Strategy. Always think safety first with oxygen therapy. Question 47. Which breathing exercise helps mobilize secretions? A. Deep breathing followed by controlled coughing. B. Breath holding only. C. Rapid panting. D. Shallow breathing. Correct answer, A. Deep breathing followed by controlled coughing. Rationale. Deep breathing expands the lungs, while controlled coughing helps clear mucus effectively. Strategy. Select interventions that improve ventilation and secretion removal. Question 48. Which client is at the greatest risk for developing COPD? A. A lifelong non-smoker with no lung disease. B. A long-term cigarette smoker. C. A healthy adolescent athlete. D. A client with a broken arm. Correct answer, B. A long-term cigarette smoker. Rationale. Smoking is the leading risk factor for COPD. Long-term exposure causes chronic airway inflammation and lung damage. Strategy. When asked about COPD risk factors, smoking is usually the highest priority answer. Question 49. Which nursing goal is the highest priority for a client with COPD? A. Maintain adequate gas exchange. B. Improve handwriting. C. Increase television viewing time. D. Learn a new hobby. Correct answer, A. Maintain adequate gas exchange. Rationale. Adequate oxygenation is the primary goal in caring for clients with COPD. Without effective gas exchange, other needs cannot be met. Strategy. Apply the ABCs when choosing priority nursing goals. Question 50. A nurse is preparing a client with COPD for discharge. Which statement by the client indicates that teaching has been effective? A. I'll call my healthcare provider if my shortness of breath suddenly gets worse. B. I'll stop using my inhalers when I feel well. C. I'll continue smoking but reduce the number of cigarettes. D. I'll avoid all physical activity permanently. Correct answer, A. I'll call my healthcare provider if my shortness of breath suddenly gets worse. Rationale. Recognizing worsening symptoms and seeking prompt medical attention can prevent severe exacerbations and complications. Early treatment often improves outcomes. Strategy. For discharge questions, choose answers that demonstrate safe self-management, medication adherence, and recognition of symptoms that require immediate medical attention.